Let's move on to another substance, ayahuasca. We've got people getting on planes and going to South America and taking ayahuasca in the jungles. We've got people all over the United States sitting in ayahuasca circles. Anybody who's taken it knows it's as powerful as a full dose of LSD. But again, it's hard to tell with ayahuasca what the dose is because you don't know the vine it came from and you don't know the mixing. People know very little about it in terms of it being what they're eating. One gulp or two gulps. What does your research tell you that you can share with us?
Yeah, so the interesting thing is there's been some labs in Brazil that have started to really do sort of modern randomized controlled trials with ayahuasca. And what they do is they will look at, different churches or indigenous use and actually, like I said, figure out the concentration. So they would say, we're doing this experiment, but we know it's this amount of DMT and this amount of harmine or harmaline. So they're identifying all the compounds in the brew that we think have these psychoactive effects and quantifying them and getting a sense of, okay, well, if we do that, how do you see people's depression symptoms improve, for example? So that's been a very interesting study, the first RCT by Paulo Fontes down in Brazil. So I think we're starting to see people also research ayahuasca, not as much in the US in terms of medical research going on, but in Brazil, there's a pretty robust network of research that's been going on that I think gives us a sense. And in terms of adverse effects, I think the adverse effects often, and again, you could go either way because the purging effects, some people get a lot of therapeutic benefit out of. But in terms of the risk during the ceremony is if you're having so much excessive nausea and vomiting that is certainly at a much higher frequency than LSD or psilocybin, people could get into electrolyte disturbances. If they've been fasting before, that could lead to sort of nutrition shifts and electrolyte changes. So there's some risks associated, I think a little bit more with ayahuasca, but still not so much more than any other substance people are taking.
We're not seeing people post ayahuasca journeys showing up much in emergency rooms, are we?
No. And I think one of the other beneficial things is they're often in group contexts, which I think creates a safer container if people are there to help each other in a group versus I think the times often you do see psilocybin or LSD cases, they tend to be someone doing it on their own or no one's around. And then people get into a lot of paranoia or get very anxious. And then they feel like they need to go to an emergency room, for example.
Yeah, if the local guides can't help them and look at what it is that's scaring them and turn it into something positive, hopefully.
That's right. That's right. Yeah.
By the way, even though I'm a clinician, clinical psychologist, I don't think the purging from ayahuasca is getting rid of internal demons and bad vibes. I think it's because people have eaten an emetic. And I think you as a pharmacist know that ayahuasca is an emetic.